Hey guys, so one of the biggest challenges that most patients have is actually after coming to my office, because it does take patients quite a while until they finally decide I actually really need help, is trying or thinking so hard about breaking the news to family members or even acquaintances or friends. So what I tell patients, because this is very, very important, I think that is also, while a lot of people do this for loved ones are usually the biggest obstacle in the way. So a lot of patients say, when we ask them, why are you having bariatric surgery? They say, for example, I have a 3-year-old grandchild, or my kid is young and I have no energy in actually keeping up with them. So they're doing it for their loved ones. They're doing it because they want to do more with their family members. Yet when they try to break the news for family members, a lot of patients are actually kind of like feeding a big hurdle there. It goes back to the same concept as I say, it's, eat less and exercise and you will be fine. Well, unfortunately, they have been doing that and they can no longer lose the weight. As a matter of fact, a lot of them now have other issues. So for example, they have knee problems, they have hip problems that they can't even move to get to the level where they can burn enough calories to lose weight. So, as I said, one of the most difficult actually obstacles is our family members. So the first thing that you have to do is, number one, you do not need to tell everybody that you're having the surgery done. One of the good things about bariatric surgery is that because it's done through small incisions, nobody knows that you've had any major surgery done. So if you choose to wait and not tell them before you actually proceed with surgery, I don't think that's necessarily a bad thing. That is a judgment call. And you will need to make that decision. Now, I'm talking this about kind of like the second layer of people in your circle, not your immediate ones. The immediate people in the circle will definitely need to know that you are having weight loss surgery. One of the things that I encourage my patients very, very strongly is to bring their spouses, bring the boyfriend, bring family members, bring them to my seminar, have them sit in our discussions and conversations. The number of times, and I will not be exaggerating, is probably more than 90% that I get the family member more excited about it after the sit-in, and really I think it's after they understand what are the causes of obesity and why do we say metabolic surgery makes a big difference. When I explain the physiology to them, the actual science behind this, and we try to take the myths and the dogma and a lot of the prejudices out of it, I think people all of a sudden feel a lot more comfortable. And when we talk about the true risks to benefit, for example, if I was just to tell you roughly that if you do nothing regarding your obesity, especially the morbid obesity, the chances of sudden death is probably between 50 to 75% more than the rest of the population. And I'm sure when I explain all that to loved ones, they start understanding what is the reason that the patient is trying to proceed with this. And remember, I talk about the pillars of weight loss. So while surgery is the most important one in the middle, in fact, if you put your hand out like that, like 5 fingers, they lead to surgery. Diet, exercise, watching what you eat, changing your psychology, all of these are actually part of losing weight. So it does not mean that you are going to stop exercising. As a matter of fact, because you're having metabolic surgery and because that helps you to lose some weight, you can start exercise more and actually get rid of more weight and get healthier, but also improve your blood profile, which is really the most important part of this. Improving the blood profile basically means improving your cholesterol, your sugars, your overall, essentially, workings on the inside. So that's why we encourage you strongly to consider metabolic surgery if you've reached a weight that is very difficult to reverse. Until next time.